Good evening, one and all. Are you hearing me? Okay, we just want to welcome everyone to this forum. We do apologize for the delays. We always know that we can might have a glitch here and there with technology, but we are glad that you're here, you're joining us, and we do hope that this evening, matter of fact, we know that it will be worth your while. And without any further ado, I'd like to make an apology for our president. Some technical glitches are also hindering him at this time, but I have his remarks, which I will share at this point in time. First of all, I would just want to, on his behalf, wish you a happy International Art Day, Acts of Random Kindness. And we hope that you have done your random acts of kindness for the day. If not, reserve them for lending a hand to your children's school to help them to a state of readiness. Of course, that will be a wonderful thing that you can do, act of kindness. So this evening, according to the words of our president, and these are his comments to you, this evening we are here to gain insight on the topic of returning to school, an evidence-based approach to understanding the risks. We want to listen and learn from our distinguished panelists what evidence there is that we can have peace of mind in sending our children back to school face to face. We want to learn from what they have seen in their offices and in their schools that we can learn from in our own experience here in Barbados. We hope that as a result of this session this evening, everyone who participates and watches will find it meaningful, insightful, and useful. Let me say that this event has been a collaborative effort by PTA representatives from both public and private schools on our island, and we are in this together. We are hopeful then that as we leave this evening, that there will be takeaways, that we can all find something to implement to keep our children and our schools safe and COVID-free. Those are the remarks from our president, Mr. Sean Gibbs. Ladies and gentlemen, I must say to you as well, we are here. Let me just give you the backdrop to why we're here. We are here this evening because of the fears and the anxieties and the concerns and the questions that have come about from a recent set of consultations that we have had with the Ministry of Education and with our PTA presidents and so on, where there are some real questions that people have in relation to getting their children back to school. Everybody wants this goal, but how do we do it safely? And as we discussed it and we thought about it, we felt that it would be good to hear from the pediatric point of view, as well as from those who have been there, done that, as it were, in the region, been back to school, and have seen and faced some of the challenges and have found solutions to things that we might not be thinking of right now, since we have not yet gone back in. So we want to hear from them and benefit from their experience and their knowledge. So without any further ado, I just want to thank all of you once again for being here and pass you over to Leslie, who's going to introduce our panelists.
Good evening, everybody, and thank you for joining us this evening. I have the distinct honor of introducing members of our panel this evening. I'm going to be introducing the teachers Okay, is the audio with us again? Okay, great. Thank you very much. Thanks very much, Betty. Okay, so I will, I'm not sure where the audio got lost, so I will, and apologies for the echo. I'm not sure how I can control that. Maybe if our tech support can also help to resolve the echo. So I will begin again with the teachers on the panel this evening. Our first teacher that's joining us is Joelle Bernard. She is a teacher hailing from Kingston, Jamaica. And Joelle has a BSc Honours degree and a Master's with distinction, and currently teaches 180 students at the 7th, 10th, 11th, and 12th grade levels at high school in Kingston. She teaches English literature and English language to grades 7 to 11, that's ages 11 to 16 years, and communication studies to the 12th grade students. Also joining the panel this evening, we have Troy Aline, who is a son of the soil here. Troy teaches in the Cayman Islands, and he's currently the data manager for Clifton Hunter High School in Breakers, Cayman Islands. And he's a teacher of electronic document preparation and management and information technology to 4th and 5th formers. The school, Clifton Hunter High School, has a roll of about 815 students. Welcome, Troy. And also joining us, we have with us Janet Harris, Mrs. Janet Harris. Thank you for joining us as well. And Janet is a deputy principal at one of the Cayman primary schools. So let me just give it a little bit more detail. Janet is the deputy principal at the Edna M. Moyle. Did I pronounce that correctly? Yes. The Edna M. Moyle Primary School. They have a roll of 88 students. Former subject leader and teacher of Spanish at Clifton Hunter High School. She's an author of Frankly Speaking, 120 matter-of-fact and thought-provoking readings. She was born in Coventry, England, schooled in Barbados, and she holds a BA in English and with linguistics with education from the University of the West Indies, and a Master's in Arts from Warwick University, UK. She's recently widowed, mother of one adult son and one granddaughter, aged 12. So I'm sure they'll bring their wealth of experience to the conversation this evening. Thank you. Kimberly, can I hand over to you?
Sure, thanks, Leslie. Good evening, everyone. It's my pleasure to introduce two doctors on our panel this evening. First, we have Dr. Angela Jennings. She's a consultant pediatrician and current head of the Department of Pediatrics at Queen Elizabeth Hospital. She's an aunt to 3 children who are waiting to get back to school. With us as well, we have Dr. Gillian Birchwood. She's a graduate of the University of the West Indies Medical School. She trained in pediatrics at the Brooklyn Hospital Center affiliated with Cornell University in New York, and neonatology at the University of Medicine and Dentistry at Rutgers, New Jersey. Birchwood is a U.S. board-certified neonatologist, and she's also a clinical associate professor at the University of the West Indies, Cape Hill campus, Barbados. Dr. Birchwood has been practicing since 1995. The last 14 years have been at the Queen Elizabeth Hospital, Barbados. They're both bringing us their personal experience as pediatricians on island. They're here representing themselves personally and are not representatives of either the Queen Elizabeth Hospital or the Ministry of Health in this capacity. Thank you very much for joining us, Drs. Birchwood and Dr. Jennings.
We're glad to be here. Thank you.
Thank you.
All right, thank you so much, Kimberly. Take it from you here. Good evening, everyone. I'm Ziggy Marshall, and this evening I'll be the moderator for this evening's exercise. Not going to give you a big, long introduction of myself. This evening is about you being comfortable, you asking the questions you need to ask to ensure that when classes resume next Monday, that we are really and truly fully on board with what is happening and how we expect our children to behave and how we're going to guide them to behave and in the classroom. So without further ado, and just to cover some housekeeping and some basics, we expect you to be respectful, we expect you to be civil, and to be mindful. And I'm careful with that mindful word, that caused some controversy today. Be mindful that all of us are human beings and we are here to do the best job that we can do on this evening's discussion. So if I may poke you, Dr. Jennings, and I'll go ahead and ask you the basics of COVID on the 17th of February 2022. What would you consider to be the basic symptoms of COVID that a parent should look out for in a child?
Good evening, and thank you so very much for having me on this panel. Good evening to the viewers. So COVID-19 is, as we know, caused by a coronavirus, SARS-CoV-2, and this produces variable symptoms. The symptoms may vary from person to person, but common symptoms include fever, cough, runny nose, headache, feeling unwell. You may have joint pains, you may have tummy pain, vomiting, diarrhea, loss of smell. Those are the most common symptoms that we see in patients who have COVID-19.
All right, so based on those common symptoms, would you say that we should, and any of the doctors can take this, would you say we should look for anything special or different with the new variant, with the Omicron variant? Anything should we look for distinctly that this variant would show that the others wouldn't?
So the Omicron variant is similar. However, in the pediatric population, we have seen fever, not as much as before, less cough and runny nose, more, we've seen sore throats, we've seen vomiting, we've seen diarrhea as some of the more common symptoms that we've seen with the Omicron variant in the pediatric population.
I would like to add that in many situations, the symptoms can be really mild, and so parents may not pay much attention to the symptoms, and the symptoms can be quite transient, lasting for a few hours, and perhaps parents may disregard the symptoms as possible symptoms of COVID, but even very mild symptoms can be indicative of COVID-19.
All right, well, glad that you went there, Dr. Birchwood, because I'm going to take you on that premise. So how do you advise a parent not to overlook symptoms, not to say, man, she just got a little cough, so I ain't bothering with that? Because if I'm correct, we've been told over the last couple of months that it can go from one extreme to the other extreme very quickly. I'm not sure if with the new variant, you can let us know if that can happen still. But how do you advise parents on how to handle the situation where the symptoms are mild initially, or it's just one symptom, a little cough, a little sore throat? What would you advise a parent to do in an instance like that?
Well, as Dr. Jennings mentioned earlier, the possible symptoms span a really wide range. So because they can literally be anything, when parents call and tell me that their child is unwell, one of the first things that springs to mind for virtually any symptom is the possibility of COVID-19, especially given the fact that we have widespread transmission. So I think that I always advise parents, you may think that this is really mild, you may think that it is nothing, but it is really much safer and better to get the testing done so that you can be really clear about what is happening with your child. Because then what happens next depends on whether your child has COVID or not in terms of the advice that we would give. So I tell parents, don't disregard even mild symptoms, even things like, I think my child's sinus problems are getting worse. It really actually may not be sinus problems. And so it can be confusing for parents. If you are not sure, it's better to speak to a health professional.
All right, thank you. So what I'm getting from you then is that we should still test, regardless if the symptoms are mild or severe, as long as you are aware of symptoms being pronounced in a child, you should still test. But let me put it out there. If you hear me clear my throat, the Sahara dust has been getting to me the last 2 days. So yeah, just let me make that clear. All right, but I'm glad for that point that parents are advised to still test. Do not take anything for granted. Test, because what will happen then is it's going to lead me into my next question, and that has to do with multisystem inflammatory syndrome.
Mm-hmm. Okay.
How prevalent is that in the Caribbean, in Barbados? Have you seen cases of that? What has led to these cases? Is it negligence on the parents' part? Is it something that you don't see coming at you and it just hits you like a bulldozer? Give us some insight, and both of you can share the question. Give us some insight on MIS.
Okay, so I'll go off first. So multisystem inflammatory syndrome of childhood really is an inflammation of the organs within the body. This usually happens between 4 to 6 weeks after a COVID-19 infection. And I will take the point to say, you know, it is no one's fault. We cannot necessarily predict which children, having had COVID, will develop MIS-C. So it really is something that we want to be vigilant and look out for. Symptoms of MIS-C include fever, prolonged fever, so usually fever for 4 or more days. And the other bits are variable. You may have headache, you may have back pain, joint pains, you may have a rash, you may have redness of the eyes, you may have vomiting, you may have diarrhea. So the important thing here is to recognize that it comes on the background of having had COVID. Now, another important thing here to note is that persons, as Dr. Birchwood said, because the symptoms may have been so mild initially, parents may not even have been aware that the child had COVID. So that is something to, you know, to put into the mix, that a child with fever, prolonged fever, plus symptoms of inflammation in any of the organs will raise the possibility of MIS-C occur, to be something that we will think of, especially when there's widespread community spread. And I want to say that parents should not blame themselves if a child develops it, because it has nothing to do with negligence. We actually we're not even really sure which particular set of children are at risk. We have some idea of, you know, who may be more susceptible, but there's still no absolute gold standard to say if this child will get MIS-C versus another child.
Okay. That last part I think is very important, because oftentimes persons would ask themselves, what did I do wrong? How could I have avoided this? So I'm glad you put that out there for persons to hear. You want to add anything to that, Dr. Birchwood?
The only thing that I would add is that parents may not think about it if they did not know that their child had COVID. So remember that children may have COVID and have absolutely no symptoms. So just because you don't think your child had COVID does not mean that they did not have COVID. So if your child develops an illness, particularly if it seems to be a more prolonged illness than you would typically see, we would certainly consider the MIS-C, because in some cases, the parents were completely unaware that their child actually did have COVID. And it's only on subsequent testing that it was able to be demonstrated that, in fact, the child had actually had COVID previously.
All right, thank you so much. I'm going to give you all a small break and take us across the Caribbean to Jamaica to get a feel from that side of the world for how things have been now that classes have resumed. I know that's something that a lot of people are interested in. What has been happening there? How have they been coping? How has this other country been coping? So I'm going to open the floor so I can get some comments from what we call them, our Yari counterpart on what's been happening in that side of the world.
Okay, so I'm imagining that's me, right, Ziggy?
Yes, Ms. Madar.
Okay, so here in Jamaica, I think we've basically gone through the whole mental experience. And as a teacher that has spent most of my time teaching at home, face-to-face with the computer, you know, it was a mental transition to take myself back out of my solitary confinement and reintroduce myself to such a large student population again. The school itself has about 1,300 students, and I'm interacting with a high number of students at any given point in time. Certainly more people than I would typically encounter in my average day. And so it took some mental counseling that I did with myself to take myself out of the fear that I had of being in society and going back to school. Having been back at school, the fear, I would say, evaporated maybe within 5 days. The first couple of days, it was, wow, we need to double mask, hand sanitize constantly. But slowly, as you move through your daily activities and get into the classroom setting, a transition takes place, or a transition took place with me. And certainly my interaction with my fellow teachers, I have heard them expressing the same thing. The transition that takes place is where we start to move from that fearful place of thinking that once we're out, we're going to get coronavirus, to understanding that we can actually safely interact with each other. It is a situation whereby we have expanded, let's say, put students into larger classrooms. And so there is a little more distancing. Each student's chair is about maybe 3 feet apart. The rooms we're using halls for the large classrooms and half classes in some instances. But at the end of the day, the critical thing was that the student engagement moved. I mean, we were, you're talking on a computer to students, you ask a question, you wait a few minutes for a response. As soon as you ask a question, you almost have to say, okay, students, one at a time, remember to put your hands up. The engagement completely changes when you have them face to face. And I think as almost every teacher is going to have that sense where as soon as you get into that classroom, you have the understanding that the students need this almost more than we do. As much as we think isolation was good, the type of learning that they do when we have them face to face, it's quite a phenomenal difference. And you feel the impact. And so that starts to break down the fear. And that's been my experience so far. It's been a few weeks. And, we're going strong. And I would say that it has only been a positive experience. Some people who had maybe a greater fear have still been able to overcome it, because as you continue to put yourself in the space, you realize that it's not so like, well, for me, it hasn't been a reality that I caught coronavirus because I went back to school. And that's been a relief. Although for the first couple of days, I was like, nobody come near me. I might have corona. But no, I'm a lot more relaxed and it's a lot more comfortable of a situation. So, yeah.
All right. Thank you for that lengthy explanation. You touched on a wide variety of issues that are being raised here in Barbados. Some teachers are hesitant to go back into the classroom. Some are going to return on Monday, the 21st, and some are going to return on the 28th. And I think it has to do with the same mental challenges of not wanting to go back in and not knowing specifically what the risks are. So you were very thorough in your personal experience. And I think that's, if they're listening, I think that's going to give them some encouragement that the end of the world is not going to come next Monday. What I can ask you objectively is a question that I've heard being asked over and over again. Hopefully you can address that for me. That is, why is there that hesitance though to return to the classroom, although a teacher lives a normal life? So you usually still go to the supermarket, you still buy fuel, you still do these things. Persons want to know because they're trying to understand, they're trying to be empathetic with you. So I'm sure if we can give them that background as to what causes that hesitance, then there won't be so much name calling and bashing and saying teachers don't want to work. And it goes down the whole road. But really and truly, I know persons still want to have a thorough understanding of what you go through, because I know from the homeschooling, I'm tired of it. I can't do another 2 weeks being an infant with my little sister. So here you can go ahead and let us know your perspective on that.
Sure. Well, I mean, without a doubt, I think from what we understand of the science, the more time you spend with the more amount of people that you spend it with, it increases, let's say, the likelihood of you contracting coronavirus. So there's well, if you wear a mask and they wear the mask, and if it's a KN95 mask and you spend 1 hour together, this is the likelihood of you getting corona. So I think the initial fear has to be simply, if I'm exposing myself to so many people for an extended period of time, on an average day, I might teach for 4 hours and have consultations in between. That is a complete transformation. Even if I were going to the supermarket, I surely would not be interacting with 40 students at one time or 40 people in close proximity. So there has to be that initial sort of, well, it's so many more people than I'm accustomed to. That fear, as I said, it dissipates very quickly. It's almost like the fear of driving a car for the first time. But as soon as you put yourself out there and you just keep trying, you overcome it really quickly. And it is something that we remember. Your memory, your teaching memory comes back to you really quickly. I think the first week of teaching, the common, thought is, oh my God, I'm so exhausted because it's so physical to teach, you are really up and down. So there is that transition that we have to make as well, from posting in Google Classroom to going back to face-to-face. But the honest situation is that every teacher, I believe, who makes the transition remembers very quickly, that feeling, the purpose, the sense of purpose that we have when we are with our students. And that is the reward that we look forward to getting. That's why we do this job, to have that interaction with our students. And it is absolutely not the same on Zoom or via computer. And I think that really helps us to overcome the hurdle. That's been my experience. But the fear is, I think it's a valid fear. Everybody has that fear. Everybody who has had the opportunity to operate in isolation, we've been insulated from the situation. We've been insulated from the problem, and we appreciate the time that we had to be insulated. When other people in other professions, nurses and doctors, were not able to do so. But, we now have the opportunity to stand up and do our part. And I feel really good about the opportunity to get back to face, and seeing the looks on my students' faces when we're in class together, it makes it all worthwhile.
All right, thank you so much for that submission. I'm going to throw a question from a parent out there. How are families, particularly those with vulnerable loved ones at home, to mitigate against the increased risk of COVID being brought home from this school environment? Dr. Jennings, Dr. Birchwood, any of you can tackle that, but I can read it again so we're clear. How are families, particularly those with vulnerable loved ones at home, to mitigate against the increased risk of COVID being brought home from the school environment? So in Bajan terms, you say in school, they try to bring back home that thing for me. That's the road it can go down. So
Yes.
What would you say to a question or comment like that?
I can probably take that question. So the first thing to understand is, what is the actual likelihood of COVID transmission in school? Unfortunately, we have a lot of international evidence from societies where children have been back in school for months and over a year and more. And what they have found is that the risk of secondary transmission, that is the risk of spread from someone who has come to school with a positive test and spreading it to another student or another teacher, that risk is actually very low once protocols are followed. Okay, so the risk of secondary transmission is actually very low. The second part is that, reducing the likelihood of spread starts at home. So as a parent, you need to emphasize, teach, and reinforce all those protocols that we know already work, making sure that you have an appropriate, well-fitting mask, so one that covers the nose and the mouth and doesn't have gaps along the sides. The second aspect of that is, if your child is eligible for vaccination, that they should be vaccinated, and also other vulnerable family members who are eligible for vaccination certainly should be. The third part is hand sanitizing and social distancing at school. These are things that are going to be reinforced in the school environment. So the factors that are going to reduce the likelihood of spread are the same protocols that we are all familiar with, which are tried and true and have been demonstrated to work. And as a matter of fact, it's been shown that compared to general society, that COVID transmission in schools is actually lower because the protocols are usually quite comprehensive. Most children are quite compliant with them. And so I do not think that parents should have the expectation that there's going to be, massive spread of COVID in schools. That's actually been shown to be a myth once you follow the appropriate protocols.
All right, thank you for that thorough answer. So, how soon would you say after contact with COVID-19 is a person capable of spreading the virus?
Okay. All right. I'll take that one. So we are looking now at the incubation period and the period of infectivity. So if I have COVID-19 and I'm in contact with you, I'm usually infectious 1 to 2 days before I actually show symptoms, and up to about 8 days after I've shown symptoms. So 2 days before and about a week after I become symptomatic, I'm considered contagious and can transmit the virus to another person.
All right, so 8 days after we become contagious. And this question was birthed from a huge question that a parent sent, but it's very relatable because it comments like this. It will be cumbersome and next to impossible for the schools to police the students exposed to public transport.
Yeah.
So I sit next to my best friend who sits next to his friend from the next school, from the next gap, and we go to school in the bus next to each other, not social distance. And then we go into the classroom and then we are forced to social distance, wear masks, etc. So what's the logic behind that? How do you educate a layman who's looking at that and saying, at school, you're stressing out my child to wear a mask and to social distance and to enforce these protocols, but then when school is over, you get on the bus, you sit side by side, and you travel home? Is it the same thing with the distance and how long you've been exposed to the person on the bus? How is that dynamic play out?
Right. And that's an excellent question because it's something that, we've looked at. And I think the important thing here to remember, there's just not one thing. We're looking at multiple layers to try to minimize the risk of transmission. So if you're in that minibus, that are bus going home, in addition to, you're not going to be physically distant at that point, but you're going to have your mask on. You would expect that the windows in the bus and the Z are open so that there's constant airflow through the bus. In addition to that, you, the child, should have your hand sanitizer. So when you get on the bus, you hand sanitize. You touch the surface, you hand sanitize. When you get off the bus, you hand sanitize as well. So you're looking at multiple layers to minimize that risk. In that situation, so we know that if you are unable to physically distance, the other aspects of probable prevention come into place. Mask wearing, and as Dr. Birchwood said, that mask has to be on and it has to be on properly. It can't be above your eyes, under your chin. It needs to be covering your nose and your mouth. It needs to fit snugly, and there should be no spaces at the side. So your mask is on. The windows are open. You're sitting next to a person, yes, but the other measures are what would be important in such a situation because you could not possibly physically distance in a transport vehicle.
Okay, thank you so much. So with regards to surface transmission, then it's imperative that we remind our kids to sanitize and wash their hands, keep your mask on and those things while using public transport to avoid
Absolutely.
contamination. All right,
Yeah.
just making sure I'm following. So going to take you down a different wavelength now, because we've had questions related to vaccination. Why are the Form 1 students going into school during the first week, especially since those children are not vaccinated? So a parent is asking the doctors to weigh in on the level of risk the children who are not eligible for vaccination at this point, because I'm sure we will remember when we were first exposed to COVID, the messaging was heavily intentional on going out there and getting vaccinated. So parents are concerned that you're asking their kids to come back into school, especially the ones that are not eligible to be vaccinated.
Yes. Yes. So, I understand parents' concerns. I'm a parent myself, so I do understand these concerns. But, we need to take a step back and look at the importance of school on the whole. So we think of school as simply an educational environment, and yes, it is. But schools are also very important for children's social and emotional development. It's where they play, they socialize, they interact with one another. They are able to access resources that are not available at home that really impact and enhance their development, like the school library. They learn to play an instrument, they play a sport. Schools are a safety net for children. They can, it's easier to detect whether or not they've been exposed to abuse. It is a really important, essential service for children. It's also important to understand the impact that being at home has had on children. And numerous studies have really clearly shown, and these are studies from the World Health Organization, the Centers for Disease Control, from very well-recognized journals that are considered to be reputable. So the studies have shown that the impact of being at home and being in a virtual environment has had major consequences and has been associated with educational loss that we perhaps will not be able to regain in many children. There's been this psychological impact of being at home, with anxiety and depression. And there's also been the physical aspect of being at home with increasing rates of childhood obesity. So these are the factors that need to be considered when we're looking at the children going back out to school. And the final aspect is, at the beginning of the pandemic, we didn't know a lot. We didn't understand everything. The studies were not there. But now the studies have shown that they are really effective measures to prevent transmission in schools. And so we will know that there is not a very large risk to children going back out to school. So it is considering all of those factors, the impact of being out of school, the fact that we have effective preventative measures, and the fact that there is a bad adverse psychological and emotional impact of being at home, considering all those factors together and knowing that it is considered quite a safe environment, that it is therefore recommended that children who are not vaccinated should still attend school.
All right, thank you so much. You knocked all of my questions across the board. I like when that happens sometimes. I'm gonna move over. I gave you a break sometimes, so I'm gonna go over back to the teachers. And Mrs. Harris, if you wanna take this one for me. Have you as a teacher found there to be complex issues with the protocols that exist in schools? Do children generally follow them? Do you want to give any tips for enforcing? How is that being impacting the development and the operations of children as they be moving around in school? Does it start from home? Is it a parental issue? Advise us on the enforcement of the rules to keep children safe.
Well, you can call me. I'm my school's enforcer. Yes, it's a primary school, so you're dealing with young children. And it's a constant battle of saying, pull your mask up. Personally, I wear 2 masks. And so I lead by example. And I always have my thing. I don't know if you can see it. This is around my neck. So I have my hand sanitizer. We have sanitizing stations. So it's a constant, once they're leaving the classroom, they wash their hands, they sanitize. When they go to play and they come back in, they sanitize. Now, the thing about it is when you're playing, you don't have a mask on. And so, and even sometimes like when they're eating, we have a staggered lunchtime. So we don't have all the students in the cafeteria at the same time. So staggered lunchtime, and they're seated about 3 feet apart. We have markings on the seat so they know where you should sit. Once they're eating, there's to be no talking. And we do, and it's done. They know, because we know that the droplets and so on. So they eat in silence. But the irony of the whole thing is then they go outside and play, and they're over each other. I think that we've done a pretty good job. And mind you, we in the Cayman Islands, we have been back at school since September 2020. So we shut down in March of 2020, but in September 2020, we went back out to school. We had an outbreak. I call it an outbreak in the community late last year. We did not close down. We continued going through it. And what has happened is that you've seen more and more children who have come down with it, but they've come down with the virus. They have, done their testing. We do lateral flow tests. So at this point in time, every parents who have requested, each student, the students who, if they've requested for a lateral flow test, they have 4 weeks of testing twice a week. They test Mondays and Thursdays, or Sundays and Wednesdays, and they test. Of course, if it's a positive, then they would have to go on to do the PCR test. I don't know if they're lateral flow tests in Barbados right now, but we find that works very, very well, because parents are able to test their children. And I know the economic situations are completely different. The government here provides a lateral flow test. And so parents are able to test their children. So if someone in the family, and by the way, if someone in your immediate family tests positive, if that child or somebody else tests negative, they can still come out to school. So it's not because you have a positive case. And I know you asked me a specific question, but I want to piggyback on something that was asked earlier, a question that was asked earlier. I was one of those who had a person, my husband, who had a compromised immune system. And I was like, I sheltered him, and you couldn't go. And I made sure, and I was working remotely, because in my position, I could work remotely because I don't actually teach. And I was working remotely to safeguard that kind of thing. And I recall, and I like to talk about, I always give my stories in anecdotes. I remember we went to Miami last year. Neither one of us was vaccinated. And before I left, person said, you be careful, you're going to Miami and the virus down there real bad. And when I got there the week after he got there. And yeah, I was like, somebody come in. I got on a mask and I like, somebody come in. And he would, listen, you need to calm down, or let's go back inside. And I'll tell you what God did, and I could say it's God. I always say God has a sense of humor. The second visit to Miami, he was coming out of hospital, and I went to meet him, and they said he has to go to the pharmacy to collect medication. And I'm thinking, the pharmacy is going to be at the hospital. Guess where the pharmacy turned out to be? In Publix supermarket. So here it was. I was so paranoid about being amongst people, and the Lord puts me in Publix supermarket in a pharmacy. And that, allayed my fears. It's like God is saying, I'll take care of you. I follow the protocols. I wear my mask. I sanitize. But at the end of the day, we serve a great, big, wonderful God. He is our protector. And I think that you follow what the authorities say. I understand the whole idea of fear because I have been there. But our children, I talk to them, you make sure you pull your mask up. We have the distancing and all of those kind of things, and the hand sanitizing. So, I think that here it is in the Cayman Islands. They're pretty much, I would say, Troy, I don't know if Troy would agree with me, pretty much under control in terms of we're living with it. We have protocols that come out regularly. There may be a change in protocols, and we're advised as soon as they come out, and we follow those. And parents are constantly advised on if something is happening. But the fear, I understand the fear, but it is something it's here for at the time. There's a joke in Cayman Islands now that they don't ask, they usually ask, who has not caught COVID? Because it's like everybody is catching it and, getting through it. So, and it doesn't have to be a death sentence. It does not have to be.
All right. Thank you so much. Your answer, you're gonna ask me to beg for some more from this panel. And I stuck a pin at something you said. And you said that the children play without masks. See, I stuck a pin right there because I'm sure parents on the live that are watching are asking themselves and saying with the same thing. They go to school in the mask, they're gonna come home. If they live in an intimate village setting, they're gonna go outside and they're gonna run around and play without the mask and then go back to school and wear these masks. So how do y'all manage that protocol difference? Because to me is retroactive when you're looking at it. Where you come to school, you sit, you wear the mask in the classroom, but when we go outside to play, and you're actually being allowed to play, and then you're not wearing the mask. So how do you find how do the academic, the faculty respond to that, and how do parents respond to that?
Do you want me to continue to answer your question?
Yeah, go ahead.
Okay, so in terms of from the bus, you wear the mask on the bus. The bus wardens, because we have bus wardens. If you don't have a mask getting on the bus, you're not allowed to get on the bus without a mask. They will provide you with a mask. When you get into class, the protocol says you sit at your desk. Your desk are a certain distance apart. If you're not in close proximity to someone, you can pull down your mask. You go outside. I said you walk to the cafeteria. You've got your mask on. When you're walking along the corridors, you've got your mask on. The teachers have come to understand. Now, I will tell you, we did have 1 or 2 staff who were really thinking we should shut down when this outbreak occurred recently. No, my safety is at risk. I have someone at home who's compromised. And what I've found, believe it or not, those who have been so careful are the ones who have contracted it for some reason. It's like the irony of the whole thing. But teachers, everybody more or less on board. Our cleaners are sanitizing regularly. Those knobs, the things that are where you have those areas are highly, used areas, they're sanitized. Once children leave the classroom, the cleaners go in and they clean. Once they leave the cafeteria, we've got staggered lunches. So when one group is out, a section is being cleaned. Their classrooms are being cleaned. So it is a case where, persons are on board. And even if you have 1 or 2 persons who may not be in agreement, you still, you go ahead. This is what's happening. This is what the protocols are. And yeah.
All right. Thanks for that. As I'm wrapping up the mass, gonna throw one out to our 2 doctors, and it has to do with the same thing of not wearing a mask at lunchtime, actually playing at lunchtime, and then return to classroom from a medical perspective. And a parent wanted to know as well, can you confirm whether cloth masks will be permitted in school? Is face shield going to be a requirement? And the difference in mask types based on the variants and what exposure levels we have now. Where should parents be going and what should you be purchasing? What should you be equipping your child with to ensure they have the best advantage to remain safe? And on top of that, when you're closing out, let us know. And I guess it can be a risk assessment. How do you determine how long a mask should be worn during school time? Yeah. So I think I gave you all a handful, so you can let me know how you feel about those.
Okay, fine. So we are looking at a few things. The first thing would be wearing the mask in the classroom and not wearing it for playing. And what I think we need to appreciate are the difference in the environments. In the classroom, you've got persons that are put 3 feet apart. When they're outside playing, they're wide open spaces, they're out in the open, so there's constant airflow, etc. So unless they're playing, I don't know, something where they're falling all on top of one another, in which case they're then in close contact, the recommendation would be that if they're out in the open, they've got air flowing through, that they can play without having a mask on. And then to understand why then, when they're in the bus and in the classroom, that they have to have the mask on because of the spacing. You're 3 feet apart, you're in a room, even though there's airflow, it is not as much as what you would have on the outside. So that would be the rationale for why in classroom, on the bus, you're going to be wearing a mask. Outside playing, you wouldn't need a mask. And there are 2 things. In addition to that, you need to think of safety. If the child is running around, they're sweating. and the mask becomes wet and soggy. So that mask is no longer offering any protection. You also recognize that the mask itself could then also become hazardous, especially for the younger kids. You know, I may become entangled in your mask, etc., and that then brings its own issues. So we have to look at the logistics of it in terms of, from a safety point of view, what is the safest way to wear the mask and when the mask wearing is appropriate. That would be the answer to the first bit. I've forgotten what the rest was. What was the other bit?
All right. Forgive me as well. So I was there writing, you know, I take my notes, copious notes I take. All right. So you handled the first bit with regards to the playing with the mask. The second bit had dealt with the type of mask, and that can touch a variety of bases, what you can afford, what you cannot afford. There are going to be parents who can afford to purchase masks, purchase a certain type of mask, and then once we're going to be determining on the 7 masks I had made, I can wash those, or if it's not even 7, let's say you're fortunate enough to have you can change 2 in a day, so you get a cloth mask before lunch and then after. So I know parents have different questions to try to understand where they're going in terms of protection and with the type of mask and what they can do on.
Right. So on the subject of masks, I think the fundamental thing here has to be the mask must be well-fitting. It must cover the nose and mouth, and there should be no space. And I think that is fundamentally the message that we want to get across. We recognize that, especially with the Omicron variant, that cloth masks are not as effective as, for example, a KN95 mask. But within each mask set, there are things that we can do. Cloth masks can still be used, but they must have a minimum of 3 layers. Or you can double mask. You can wear a cloth mask and a surgical mask. You wear the surgical mask on the inside and then the cloth mask on the outside. Or you can step it up and you can have a KN95 mask or a KF95 mask are also options. The ministry, in terms of what is recommended, looking at the roadmap, they've given you the option, and it really is going to come down to understanding the importance of what having a mask means and the correct way of wearing the mask. Because you can have a KN95 mask and wear it under your chin, or it not be fitting snugly on the face. So it's not just about having the mask. It really is, how does that mask fit this child's face? Is the child comfortable in the mask? And what is the likelihood that that child will remove the mask in a situation where they're less than 3 feet apart, there's somebody coughing, sneezing, etc. So it really is about having the child comfortable wearing the mask, being aware of how to put on and take off that mask correctly, and wearing it for the allotted period of time. So I think that really is the message, that the mask must fit well. You can have 2 masks on, you can have a KN95, you can have a cloth mask with at least a minimum of 3 layers for that mask, or you can double mask.
Okay, all right, thank you so much. I'm going to drag in Dr. Birchwood now, so she can take the last part of the question, which had to deal with any risk assessment that was done on how long a child can be in a mask in a day. Is it safe to be in a mask 6 to 8 hours a day?
Yes, I mean, that is a question that I think parents were really concerned about in the earlier parts of the pandemic. And to answer that question, there were a number of research studies that were conducted in children and in adults. And what has been clearly shown is that there is not a risk of the child not getting enough oxygen. These masks were designed to filter particles like viruses, for example, the KN95. They were not designed to filter oxygen. So oxygen particles can move freely in, and carbon dioxide, which is our waste gas that we produce, can freely filter out. So there is no concern that the children are going to have a lack of oxygen or buildup of carbon dioxide, or that it's going to affect their lung development. Those myths have long been debunked. And, you know, just to provide a point of reference, surgeons stay in masks all day doing complex, procedures, and they are not impaired. So I don't think that parents need to have any concern that masks, KN95, KF94, cloth masks, or the disposable surgical masks, none of them have been associated with any risk of compromise, even to very young children. And there were studies in children even as young as 2. which conclusively showed they're quite safe.
All right, thank you so much. So I'm glad to hear that there's no evidence at this time to show that masks affect children's development. I'm gonna let my mother know that because she thinks that the mask, yeah, yeah, anytime she puts it on her face and walks 2 steps too far, she say, you know, this got me can't breathe, you know, this got me can't think clearly. I turn around twice in the supermarket, I forgot what I came for. You know, she started to blame everything for the mask. So I'm gonna let her know that's just all in her mind, and she's creating these instances. All right, so moving on. What are the adjustment problems that parents should look out for as children return to the classroom? What have you seen in your experience as teachers? And you can take this from a psychological standpoint, behavioral, curriculum, and learning. Ensure that I'm going to give everyone a chance to actually tackle this. Ensure when you get into this question for me, you also touch on if you've been forced to do what we call a blended approach. You have students home and you have them at school. Have you been in the experience doing that? Is it possible? Can you get it done? I'm going to go over the question, but tell me about the adjustment problems that parents should really look out for as children return to the classroom. And are they mainly psychological, behavioral? Do they share the same weight? And any learning issues? Yeah. You want to start for me, Troy?
Sure. Well, just to say, the learning curve is steep for everybody, more so the parents than anybody else. And I think we learned quite a few lessons coming out of COVID and going through the COVID process. As Janet said, we were in for a relatively short period of time when compared to the rest of the Caribbean. From 2020 September, we were back out to school, and we've been out. We haven't closed our doors since then. Um, the the expectations may vary from time to time. I think in our scenario, we were eager to get things going again in the Cayman Islands, and it's almost as if school just started again. We had our protocols in place. We sanitize getting onto the bus. We wear the mask on the bus. As the children get off the bus, they sanitize. When they get to the gate at the school, they sanitize. So there were all these new protocols, but after about a month or so, we got our act together, and everybody was on point. Um, One of the things I do at my school is I collect data, and we collected quite a bit of data with respect to COVID and its effects. Teaching and learning, for example, we discovered that the teaching and learning across the board dipped while the students were at home. Why? Because students are not accustomed to learning online. Teachers aren't accustomed to teaching online. Parents aren't accustomed to having to be play that assistant teacher role. And for the time the students were at home, in as much as we tried to provide as much as we could for them, it just didn't work. We had logistic problems. Bandwidths at home were different. For big families of 3 kids, it was a problem. Only 2 laptops, so one child had to use a phone. There were all these different things happening. Once we got back to school, though, one of the initiatives that was pushed by the government here was we provided a laptop for every single child in school. Now, parents really appreciated that. It created an opportunity for a lot of people who didn't have it before, and it also created a lot of problems. I'm not going to get into what that scenario looked like, but it was an effort on the part of government here to try to make sure that teaching and learning continued. And I must say, coming out of the external examinations for 2020 and even 2019, those efforts really did pay off. We saw that our results, in particular across CXC, were really, really good, above average in most cases across the Caribbean. However, you've got to look at the good with the bad. We still haven't recovered psychologically from the lockdown. We've had quite a few kids and I'm speaking personally at our school, 1 or 2 of them who withdrawn from school and are now being homeschooled. We've had some teachers who've had to really take a check of themselves, because we had scenarios where you were in lockdown, you couldn't move. COVID was rampant throughout the world. We had loved ones dying. You weren't able to travel to mourn with your family, et cetera, et cetera. And this has had an impact throughout the Cayman Islands. So to say that we were back to normal, really, what is normal? You know, we are at a place now where we are coping a lot better than we were before. Yes, we are at school. Yes, we are having classrooms and classes face to face, but there really is no normal. You know, this is what we've come out of. Um, I'm gonna stop talking here, and if Janet wants to jump in, because I know the secondary school situation is different from the primary school situation.
Yeah, so yeah, I'm gonna invite Mrs. Harris to come in there and tell me psychologically, how do you find those older children behave on rejoining the classroom, having been home all of that time? What advice would you give to our teachers here? What should they do? What are the resolutions? How do we guide them into being, and as Troy said, there's no normal, but where does a teacher stand in ensuring they facilitate that resumption to feeling as normal as possible after having such a long time away from the classroom?
Well, I will start by saying the guidance counselors are their work is going to increase, because you do have students with that emotional, the students who came back scared. You've been home for a long time, you are scared. Then, you're getting what is being fed to them at home will heighten their fears. And teachers have to be empathetic and sympathetic. It is not that the child is being difficult or that the child ain't got the manners or they ain't know how to behave. It is that there are other underlying things. It is that the fear. It is that I've been home for a long time, sheltered. I'll tell you, my granddaughter is 12 years old. She has just started one of the schools in secondary school in Barbados. Started but hasn't gone there yet. And she has said to me, she doesn't want to go back. She does not want to go. And I'm trying to say to her, we are social beings. She is happy being online. But there are children who are anxious to get out among their friends, but having gone out there, there are going to be issues. So you have a child like her who would rather stay at home and be home and to learn online. When she gets to school now, how do you teachers have to be cognizant that you're going to get students of different mindsets. And yes, it is hard for the teacher as well. And you have got to try to strike a balance. You're going to either make or break those students. You got to strike a balance. It is not always very easy. And there's some students, the whole idea of they call it social distancing. I don't like the phrase. I prefer physical distancing. We are social beings. But that whole thing, I mean, even with my recent grief, there were people who came to hug me. You're hugging because that's what you do. Normally when someone is grieving, you hug. But you got to remember, you're supposed to physically distance, But yeah, so you have students, it's hard to get them to understand. You got to keep the distance from your friend that you haven't seen for such a long time, and you're so glad to see them, And I think teachers, you have to give and take. Give and take. Try as much as possible, pick your battles, because there will be several battles that you're going to be faced with. Pick your battles well. Because
You want to add something there, Troy?
If I may. Now I know the fear of catching the COVID is really, there's so many people that are extremely fearful of it. As Janet said earlier, we did have what we would call an outbreak in our community since November of last year, when we slightly opened the borders. But I've got to tell you, as students came down with the virus, went home for a couple of weeks and came back, that fear has decreased and decreased and decreased to the point where, we get little messages. Mr. Allen, I won't be in school today. I have COVID. Could you just send me the work online, please? So the fear is subsiding. We even have kids who are now on their third. I would love to ask a question of the doctors about this. On their third bout of COVID, obviously they're saying things like, Omicron is as potent as some of the other strains and so on. But I must say that fear has now subsided. And that fear was not just for the students, but for the teachers as well. Because as the students became ill, the teachers became ill. We had a situation where about 10% of our staff were out. We went all the way down to 65% of our student population being present at school. And this happened for 2-week cycles. So a batch would come in and another batch would go out. Today was probably the best day in terms of student and teacher presence at the school. We literally had only 2 teachers out, and I think we only had about 4 or 5 students out for COVID. That's phenomenal, because that really wasn't the norm for the past couple of weeks. But we're getting back to a sense of continuity, and I really try not to use the word normal, but we're moving to a place where everyone knows what to expect, and these things are making it easier for us to exist.
All right, you touched on something there that I think deserves. I'm gonna ask you to expand on. Well, it's and my questions are open to teachers in general when I ask them in this segment. Simultaneous teaching, losing time at school, these are things that parents have concerns with. So if my child contracts COVID, and the doctors can advise me, I'm not too sure what the time frame is now, if it's still 14 days, 10 days, 9 days, whatever it is, a classroom setting allows for accelerated teaching from what I know. And then I'm away from school for that period of time, and I can't guarantee that just sending me assignments is going to keep me up to speed with the other students. What resolutions have you all put in place to ensure that those students don't fall behind? Is there access? Are y'all that skilled that you teach online and in the classroom at the same time? All of these are things persons are wondering. So you can shed some light there for me.
I'll go. It can be done. It can be done. I must say we are blessed here in the Cayman Islands. We are, compared to many countries, extremely well resourced. We can have teachers in a classroom teaching students present in front of them, while simultaneously Skyping, Zooming, whatever you have, to students who are at home. We've had a situation where a teacher was out on 2 weeks because she had COVID, and whichever teacher came to the class to sub for her, they would just connect the computer up. She'd show up on the smart board, and the kids would interact with them as if she was there in the classroom. Not everyone can do that, I know, and my heart really goes out to my homeland, because I know that so many students have been out of school for so long. I find it difficult to comprehend that some students have been out of classrooms for 2 years. And this has an impact, because the face-to-face teaching, there's nothing that compares to it. And once again, yes, we know there's students who do, homeschooling and so on, but they're taught by trained teachers trained to teach online. There's a big difference between the two. Classroom teachers are not online.
Stick a pin right there. I'm gonna have you take that back 1 second and come again for me. So you're telling me that there's a big difference between a teacher who is trained to teach online and a regular teacher?
Absolutely.
All right.
Huge difference. I don't know much about the online situation apart from university, but resources for online teaching are prepared, and you get your whole curriculum at the beginning of the year. Students know what to expect. The home is set up for it. The parents are on board to support it, and so on. We were thrown into a situation where the school shut down all of a sudden. The students can't take home every resource in the classroom, and the resources are meant to be shared in person anyway. So we had to get all creative, and what are we going to use to teach online, and what are we going to use to, it really was something. The fact that teachers taught during that time, phenomenal. Don't underestimate it, especially in the countries where technology really was not available as it was.
Yeah,
One
well,
of the things,
I don't
one of the,
undervalue that experience. Sorry, Mrs. Cyrus, I don't undervalue it, because as I keep saying, parents are well aware of what a teacher goes through. Trust me on that one. We've been trying to do, as you said, teacher assistant for the last 2 years, and some of us have been failing miserably. first you can't remember what you did. These are real life experiences, and then teaching is taught something that we learned one way is taught a completely different way now. So that's the first argument, because the students tell you up front, my teacher said it is to be done like this. And when you get that response, then you are out to sea. So you can go ahead, Ms. Harris. Sorry about that.
You also get where the parent is in the background giving answers too. But one of the things that we did was and as Troy said, we were thrown in at the deep end at the beginning. One of the things that we were forced to do as administration, we had to get the resources to the students when we first locked down. So we packed up all the resources, and then they had, parents had to come to the school and collect. At the very beginning, you had your time to collect, and you collected. We had each bag packed up with the child's name on it and the resources and so on. If we were to go into lockdown tomorrow, I can tell you we are much, 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 much better prepared. We have the online platforms. They have their logins. Everything is set up already now that if we were to go into lockdown, they are better prepared, certainly with the online platforms and so on. And in terms of hybrid teaching, which is what you were talking about, I have to talk about the government, because what the government did here was they came up with part of their, I don't even know, it's a regulation. If you were COVID positive as a teacher and you weren't showing, you were asymptomatic, then you were expected to teach because it would have been taken from your sick leave, or you might not have gotten paid. So you had...
Let's make sure that we are clear very on what you just said. When you say expected to teach, you meant in a physical classroom?
No,
this is online?
No, virtually
Virtually,
online.
okay.
So what we had a system where when we had, when it was really bad, like as Troy said, like last week before, there were lots of staff out, there were lots of students out. We went from 88 to something like 52. Today we were at 85 out of 88, 85, 84. So you see that the numbers have picked back up. But what they did was say, well, look, we need teachers because there's so many persons out. So teachers were teaching at home, they were asymptomatic, and they were teaching from home while you would have had maybe an assistant taking care of the class or being in the class, because it's different from the primary when you compare primary and secondary, because the secondary you can use an older child to at least police the laptop in the class. When it comes to primary, you definitely need another adult body. And we were, it was hard. So we made sure that as much as possible, the children got their teaching, because as was rightly stated, we can't, it's okay to just give assignments, but there needs to be a bit more than that. And we recognize that children needed to be taught some teaching to go on. And so we facilitated that as best we could.
All right, thanks, Miss Bernard. I'm going to ask you to jump in here because a statement was made, and you're in a Caribbean perspective. Not that you aren't Mrs. Harris, but I can see y'all are full of resources and different things over there. Not as challenged as other islands are, and it has to do with the same thing I asked you to repeat, which was on the teaching while you're asymptomatic. Culture. I can see culture being a real big problem there, where a teacher will say, well, they're very insensitive. They can't care anything about me. They want me, although I still have COVID, they still want me to teach. Pairing there for me, Miss Bernard, and tell me from the Jamaican perspective how you would have seen that working, if it would have worked, and without the resources. I don't think y'all had as much resources as the teachers in Cayman. Yeah, how would you survive?
Let me not sort of paint the entire Jamaican education system with the same paintbrush, because different schools have different levels of resources based on the parents' contribution to the schools or past students' contributions to the schools as well. So that can change the individual school's scenario. But as it relates to teaching while we are ill, sick leave is sick leave. And depending on the individual, if you are sick, then you are out, and there is not a requirement for you, to be present at school and teaching. So the support resource has to come from inside of the school population. But to jump over to another question, I think that you had asked earlier, which I wanted to weigh in on, which I thought was very interesting, I think, was what should parents look out for? And, I can tell you that the transition for the students is also a transition, not just mentally, but physically as well. They're coming into an environment where we're expecting them to concentrate for 6 hours straight, and the students in some instances have challenges with that. In the middle of the school day, they're flopping down on the desk, they're not alert, and they're not upright. I believe that on the home front, that might need an adjustment. Bedtime has to be a little bit earlier than usual.
Okay.
My students have told me, Miss, I go to bed at 10 o'clock. I am saying, but I don't even go to bed at 10 o'clock. So how can you be going to bed at 10 o'clock? On another note, the students are accustomed to us using PowerPoint presentations on Zoom. They've forgotten how to do note taking. I would encourage every parent, check your child's notebook when they come home from school. Remember to ask them, what did you learn at school today? Because they have become so dependent on the teachers providing them with that written material that note-taking has almost become a lost art form in a couple of years. And they're expecting us to provide them with their notes. So there are little things like those, that extra motivation. I had to buy gold stars for my students, to try to get them, to feel like we are going to participate again.
Right.
Interestingly,
Okay.
I bought gold stars for my first formers, and I strolled into my fourth form class and said, let me give this student a gold star. And lo and behold, it was motivational for my 10th graders as well. So it's those are the things that I think parents can help to support their children with that motivation, with the energy required to take you through school days, with the concentration that's required. Teachers as well have to recognize that we have to be a bit patient. The transition is not going to be immediate. So for the first couple of weeks, I did allow the students who were sleeping to just sleep during class time. I just said, this child is clearly not going to survive. So they have to go to the bathroom constantly. Like, it's amazing. Everything has changed because of the flexibility that they're accustomed to at home. So parents will need to be aware of those situations. How they used to eat at home, they probably snacked constantly because they come into the classroom and the classroom setting does not allow you to eat in class. My students feel like they have to eat. They have to eat. They're going to die. So I have observed a whole host of sort of very unique problems that I don't think we had before that have sort of crept back into our classroom setting. So things that I think there was a question about, adjustment problems, completing the homework. We give them homework to do. Used to be the parents might be able to check on Google Classroom, what is the homework that the teacher has issued and has my child submitted. That's changing right now. We're issuing homework in a face-to-face environment. So that means go back to, checking in those
Checking the books. Right.
Yeah. And checking the grades in the book as well. Let me see that book. I've asked my student, let me see your book. And the book is empty. And I'm saying, how can your book possibly be empty? This is just not possible. And I recognize a whole new situation that we have been discussing that we have to do penmanship with our students again. They've been typing so long that they've forgotten how to use pen and paper. So, these are things that are interesting. We didn't foresee them.
May I respond to something she said?
Yeah, go ahead. I'm gonna take the doctors up shortly after that. So please.
I love that you're talking about coming back into the classroom and learning to do the old things again. We, on the other hand, here, we just kept going. We still set our work on, we use Microsoft Teams here in the government schools. We still set our work on Teams. Parents are still checking homework on Teams. We still, and it helps in that when students do go off and you're sick or something, they can still continue with the classroom. When teachers go off, they can still communicate with the students. So we actually kept that online presence even though we're face to face, and we're finding that it helps. The students are accountable now to the parents, because the parents can also get onto the platform and see what's going on.
Yeah,
So maybe
definitely.
that's something we can all adopt.
All right. So what I'm hearing then, that although that reform of practices is necessary, you need to reform your practices, the culture, and that was created as a result of COVID. There are still positives that we can take away, like the online classroom, because it is convenient for a parent to look. And I'm one of our parents, Kimberly, I'm sure it's easier to her based on what she does to get on a cell phone and peep at it quickly and start, I see what the homework is here, instead of having to go and dig up in bags. And so, I understand that, and I hope that we've taken note of that and we can add that to our practices going forward. So the vaccination rate in Cayman is 87%, which is much higher than Barbados. I think is one of the highest in the Caribbean. Does that make a difference regarding how it makes society feel? Um, I want to hear from the doctors on that. Does vaccination rates affect if we feel safe, if we are worried? Because we have to do a lot of sensitization on alleviating the fear associated with COVID while still maintaining the enforcement of the rules to keep us safe. So, what do you advise us with regards to vaccination rates and society and children being a part of society and going to school? You can go ahead and let us know on that.
Okay, well, I guess I can take that question. So, vaccination is something that we as physicians firmly support. It is part of the multi pronged approach to dealing with COVID in any society. So, we know that vaccination, now that we have it available, is the backbone of any strategy, and certainly the strategy here from the Ministry of Health and Wellness. So, we know that our overall vaccination rate for people who have had the first dose, because we see it every evening on the news, is not quite 70%, although it's inching closer. The rate of people who've had both doses is around 65%. And in students who are eligible for vaccination, that's in our 12 to 17 age group, the rate is just over 50%, 50. And so we wish that there would be more uptake. We know that the vaccination does not prevent someone from getting COVID, but it has very clearly and conclusively been shown to reduce the likelihood of contracting severe disease and the risk of death as well. So vaccination, it gives people a sense of assurance, but that does not mean that you should ignore the other multi-layered aspects of prevention, which everybody knows all the protocols. It can give you a psychological ease that you're not likely to die and you're not likely to have severe disease, but it is part of an overall approach to COVID. Hand sanitizing, mask wearing, physical distancing, etc., etc.
All right. But in context of, let me throw that out there too, the vax rate in Jamaica is 21.6. So medically, what would you advise? Do you think you should you go back to school? Should you stay home and hide? We're in a context like that. You're gonna jump in here, Dr. Jennings.
And just to dovetail on what Dr. Birchwood has said, everyone is scared. Everyone is anxious about going back to school because, what does this mean? We've shown that, or we've looked at studies which show that the likelihood of secondary transmission in school is relatively low. We've seen that vaccination does minimize the risk of severe complications from COVID, and also minimizes or reduces the likelihood of a prolonged course of COVID for the individual who has been vaccinated. There's no perfect answer. Ideally, we would like everyone to be vaccinated who is eligible in order to add that to the armor that we put on as we fight COVID-19. We've got the mask wearing, we've got the physical distancing, we've got the hand sanitization, we've got the respiratory hygiene. Vaccination adds another layer. It would have been great if with vaccination we eliminated the virus altogether and we had nothing more to worry about. But the virus continues to change, and we had to hit the ground running when COVID presented itself. We didn't have a playbook for it. We're learning as we go along. We constantly get information, and we're using that information to plan and strategize about what happens next. So at this point, we would recommend, or I'm saying that, at this point, we continue to emphasize and encourage everyone who's eligible to be vaccinated. That includes the students, that includes the teachers, that includes the other staff at the school, that includes the family members, the home environment from which the children are coming, to add that layer of protection, because the COVID-19 is here and we just do not see when the end is going to be. And at this point today, all that we know is that vaccination minimizes the risk of severe infection, and all the other mitigating factors minimize risk of transmission as well. And that's as much as we can say at this point in time.
Yeah, okay. But let us speak about long COVID then. And is there any concern regarding the impact of long COVID? And you can weigh your answer in a vaccinated perspective and an unvaccinated perspective. And you can also cover adults and children, so we understand, because the school environment is dynamic. There are both adults and children in the school environment going to and fro the organization. So what would you two doctors say to us regarding long COVID and the effects of long COVID if you're vaccinated, if you're not vaccinated, and the differences between adults and children? And be sure to let us know what long COVID is, because I'm sure persons may not know what it is.
Yes. Well, long COVID is an entity that was first seen in adults in the early stages of the pandemic and is less clearly defined in children. Let me just say that out front. So what long COVID is where you have a persistence of symptoms of COVID beyond the time when you would expect resolution of the acute phase of COVID. And it can show up in different ways. There can be physical aspects, and I'm talking about this broadly to describe it in adults and children. There can be physical aspects of long COVID where you actually have symptoms related to scarring, for example, scarring in the lungs or damage to the heart that can occur. It does not necessarily need to be associated with a severe acute infection. Long COVID can happen even in very mild cases of COVID illness. So in adults, it's more well described. In children, there have been some research studies. However, it's very important to know that those research studies are not of the highest level of research quality, because it does not seem to be seen more commonly in children. I can tell you that from my own personal experience, and Dr. Jennings can probably vouch for this in her experience, that we've had thousands and thousands of children in Barbados with it. And we can certainly say that in our own offices that we have really not seen the description of long COVID. In children, where it has been described, it can be physical aspects. For example, they are winded or have breathing symptoms and not able to be as physically active as they would have been before. But there's also the mental aspect of long COVID, where people describe having a brain fog or having their intellect impaired for some period of time. They may have headaches, be unable to concentrate as well as they would have before. So I think it's important for parents to be aware of the symptoms. And when your children go back out to school, don't assume it's simply the mental adjustment of being in school. There is a possibility that they may actually be having long COVID. If you find that they're really having persistent difficulty in concentrating after the initial transition is over, they seem to be very irritable. They have, constant fatigue. These are the things that we have seen described in adults. So I think it seems clear that it is far less common in children than it is in adults, but that does not mean that it does not occur. In my personal experience, I cannot say that I've had any patients, and there have been many, many who've had COVID, who I would say have had a syndrome that I could describe as long COVID.
All right, thank you so much for that answer, Dr. Jennings. That was thorough. You have anything you want to add to that?
No, just to say that I fully concur. I do have patients that have had COVID, and to date, no one has had symptoms that would fit into a long COVID syndrome at this point. That does not, however, mean that it can't occur. And as Dr. Birchwood said, we're always vigilant, looking out, and if parents have concerns, definitely something to discuss with your physicians.
Right. If there's one thing though that we've learned over the last 2 years is that the situation is fluid, and everybody is being thrown in at the deep end, and we are learning as we go. So I'm going to throw you now in the deep end because I want to ask you about testing. Testing has been sensitive for adults, so I assume parents who are already sensitive there are going to be questions they want to ask regarding testing for children as well. Do you think Mrs. Harris spoke to testing in schools? There was lateral testing, I think. Where do you think, and your medical advice, we should go with regards to performing tests on students?
Okay. Thank you very much for that question. And that's an interesting question. If you're looking at the school community and seeing the school as a community in itself, testing can take the form of surveillance, where you're just looking to see, are there people here who are asymptomatic and are positive? So you can have, random testing, which is something that has been spoken about in different school settings. You test randomly, identifying people who may be asymptomatic and positive. Or you can test based on symptoms. If a person presents with symptoms that suggest the possibility of COVID, then those persons are tested. So at this point, we will be guided by the Ministry of Health and Wellness on the approach that will be taken as far as children returning to school, what that will look like for both the children and the staff at the school.
All right. Thank you so much. Mr. Bernard, I'm going to ask you to jump in here for me so we get a localized view on this. Is there any testing in Jamaica? Is there random testing, routine testing? Do you all conduct testing for students in Jamaica?
If that is happening, I'm not aware of it. In fact, I don't know of random testing taking place in any segment. Testing is by and large the financial responsibility of the patient or the person who is being tested in Jamaica. There is no government-sponsored testing. There is, let me retract that. There are cases where you can go into public facilities, but you have to make an appointment, and it's not necessarily the quickest of processes for us here. By and large, we have not employed that strategy, and certainly not at the school that I am at. We have not employed any such strategy. If you think that if you have developed symptoms, then you have a responsibility to test yourself and to report back to the school what the situation is. But random testing is not our reality. I think we're dealing with too many people on too wide of a scale, and that would just be completely unfeasible for a long-term sustained situation.
All right. Thank you so much. Well, I think we've had a jam-packed evening, and I'm not going to come and poke you any longer. I'm just going to open the floor for anyone who has any parting comments to make. They can go ahead and make them, because we're coming up to time, 8 o'clock. So if you think you have any important contributions that you should make after this evening's impressive discussion, you can go ahead and share those now.
I'll jump in first, because I think I got 2 minutes before my wife calls me. Some things to adjust. We've got to really think outside of the box going back into schools, and I really want to encourage Barbados to embrace it. Change is inevitable, and how we respond to it will determine the success of our children. Technology is going to be a huge part of it. I know it's not readily available to everyone, but schools, government, parents, we really got to try to make that a priority. We need a greater participation from the parents. Now, I don't mean that you have to be, teaching the kids at home and so on, but we really do need you on board to support the efforts of the schools, the initiatives. You have really got to drive your children if you want to see their success. We're going to do our part, and you're going to do your part as well. And we also have to hold the kids accountable for their own learning. And the last thing I'm going to say is self-care is so important. The doctors are doing a phenomenal job. I went to Barbados for Christmas, and I stopped at Chafet. And I came in the door, and the security guard said, well, let's go to the book. And I had to write my name, my address, my shoe size, my grandmother's middle name. It was impressive. It really, really was. I was so, and take your temperatures, and so, fantastic job. We really got to follow the protocols. Follow the protocols. We really got to hold each other accountable. This pandemic is with us for a while, and can't let it stop our learning. The Caribbean, the one resource we have are people. And if we don't develop our people, we're going to find ourselves even further behind than some people think we are. So really, let's support each other in our schools, make a priority, make our children priorities, and we're going to reap this success eventually. That's it.
Thank you so much, Mr. Ali. Any closing remarks from you, Ms. Bernard?
Sure. I want to encourage everyone who might have that remaining fear that, let's consider the children first and put them first. And if we put them first, then I believe we will have to all agree that back to school is the way to go. We are social creatures, and their development and their learning is critical for them to be back in the classroom in front of the teachers, and we as teachers have to be back in the classroom in front of our students.
All right, good. Mrs. Harris?
I concur with everything that Troy said. I think too, it is very imperative to know for parents to share where their deficiencies are, and to have some programs for the parents. I think part of the problem sometimes is that parents really, every parent wants to help their child. Sometimes they don't have the know-how. So that's where we can use the online, even though they're going back to school, use the online from the teacher's point of view to give them maybe little webinars or little videos of how to do something, that would also be very helpful. But we got to think outside the box. It is a learning curve, and sometimes it gets steeper and steeper and steeper. But yes, the children are our future, and what we do with them today will seriously impact not only their lives, but our lives in the future. And we've got to do the best that we possibly can by them.
Thank you so much. Dr. Birchwood?
Yes, I would like to say that COVID is not going anywhere. We're likely to have variants coming through. We need to learn how to live with and past this disease. And we cannot afford for our children any longer to have the educational loss, the social, emotional, psychological, and physical consequences of being out to school. With the right protocols and a very supportive Ministry in Health of Wellness like we have, I believe that we can move forward with confidence, knowing that there might be little glitches along the way. But once we get together and put our heads together, we can get through this for the sake of our children.
Thank you so much, Dr. Birchwood. Dr. Jennings?
Right. Concurring with all that was said before, I think for us in Barbados, we must become our brother's keepers. We have the children who are our future, and we have to work together to ensure that they are as safe as can be. We've got the protocols that we will follow, but if you see a child and they're not wearing the mask properly or something like that, and also as adults, that we lead by example, that we show them how it needs to be done, because children will follow what adults do. And if we say it is impossible, it becomes impossible. I think that we just need to recognize where we are. This is not going anywhere anytime soon, and we just work together to ensure the safety of our children, the safety of our teachers, the safety of the rest of the staff, and the whole entire community, because we must be our brother's keepers. Thank you.
Thank you so much. And I want to welcome with us, because she slipped in, the Chief Education Officer, Dr. Ramona Archer Bradshaw. I'm going to let her give some remarks as well before we close out. So Dr. Bradshaw, when you are ready, you can go ahead.
Good evening, everybody. Good evening, panelists. Good evening, parents. Thank you very much, Ziggy. I couldn't be here at the very beginning, but I'm sure that you had a very meaningful and productive session. I saw that there are many parents on taking advantage of the forum to learn more about getting back to school and getting back to school safely. I heard some comments made not too long ago about, let's do this together. We need your support. And I want to reiterate that we are all in this together. Parents, we need your support. We cannot do it alone. And I know you want the best for your child or your ward. We want the best for your child or ward too. So let us make it work. Let us make it work. And this forum is testimony of that. I remember being in meetings with the BNCPTA from as early as September last year. And they were talking about the fact that they wanted to get more parents on board. They wanted to have these kinds of sessions for parents. And I fully endorse this. We want to hear more from you, parents. I thank the panelists for giving of their time, because I know they're very busy individuals, but they made the time to come and share with you, share their knowledge with you, and advise you in the best way possible. And I thank them for that. I just want you to know, parents, that the Ministry of Education is here for you. If you have questions, feel free to funnel the questions through the BNCPTA. They're at many of our meetings, if not all of our meetings with stakeholders. So I'm sure that your questions will be answered. And I look forward to going on this journey with each and every one of you. And I look forward also, the ministry looks forward to welcoming your children on the 21st of February. So thank you so very much for this opportunity to chat with the parents. And thanks again, panelists and BNCPTA.
Thank you so much, Chief. Everyone really and truly had the same message. You're hearing the same things over and over again in different words. And if you go away from here, it's one thing that we will remember, that it is a collective effort. It requires community effort. We got to really help each other along as we transition into this new way of living. And as the Prime Minister would say, many hands make light work. So on that note, I'm going to hand over to Nikki. And Nikki's going to come and say a few words before we depart.
Wonderful session this evening. I must say, I really want to let you know that all of who has spoken, including the Chief just now, has made what I have to say quite almost redundant, because I just want to thank all of our distinguished panelists for all that you've shared, your personal experiences, your expertise, your knowledge. It was a wealth of information, and I'm sure that we have some takeaways this evening, whether we're parent, teacher, guardian. There was something for everybody this evening, but I think that there's so much more that we could delve into, and I want to make a plug and appeal for our future part 2 to this session, because there's so much more. Maybe we can do some check-in a little later down, and see how we've started and how we're getting along and what else we can share with each other and so on. So I just want to thank also our coordinating team. I call them the A-team. We have Leslie, Arlene, Kimberly, Melissa, Ziggy, G-Star Media, all have come together, working together. And as you've heard, this is not only BNCPTA, this is public and private PTAs working together to bring this forum to you this evening. And I want to give a big thanks, and obviously to everyone who is in the audience. We want to thank you for being here, and we want you to continue to play your part. Go out there and do your random acts of kindness for your child's school. Get out there, and somebody made a suggestion on Facebook. On Monday, you get out there and clap the children into the school gates. Applaud their efforts. Give them the courage to go in and know that it's going to be okay. So have a wonderful evening. Thanks for being with us, and look out for our Facebook and Instagram updates. Thank you.
Thank you. Good night, everyone.
Thank you too. Good night, everyone, and continue to be safe. All right. Bye-bye.
Good night. Bye.
Good night. Thank you.
I must mention Melissa Cherbold has been our background person doing all of the social media behind. So thank you, Melissa.
So glad to hear the Bajan accents.
It's true. It's true.
I love the Jamaicans too. Love the Jamaicans, but
Troy, I'm just feeling really like an afterthought here.
No.
Oh boy.
Listen, in Cayman, there are more Jamaicans than Bajans by far. So I know more patois than I think you might know.
And you know what? The Caymanians, I mean, it's a different accent from us.